Hey everyone, in this presentation we're going to talk about endometrial cancer. We're going to talk about the symptoms, risk factors. Stay tuned till the end. I have a mnemonic for the risk factors and let's get started. Endometrium is the lining of the uterus. It's one of the few organs in human body that changes in size every month throughout a person's fertile years. Cancer of endometrium is the most common gynecologic malignancy in developed countries and the second most common in developing countries because cervical cancer is more common in developing countries. It develops in 1 to 2% of women in the United States and is the fourth most common cancer in United States women. Let's talk about the main symptoms. Abnormal vaginal bleeding or discharge, especially for the postmenopausal woman, difficult or painful urination, enlarged uterus detectable during a pelvic exam, unexplained weight loss, which is also important for the other cancers, pain during intercourse. The incidence of endometrial cancer peaks between ages 60 and 70 years, but 2 to 5% of cases occur before age 40. Because women under age 50 who develop endometrial cancer are often at risk because of chronic anovulation and obesity. Basically, it's caused by unopposed estrogen. In chronic anovulation, I can say polycystic ovarian syndrome, and in obesity, estrogen accumulates in the peripheral tissues. We have a mnemonic for the risk factors, which is called NOT. C for cancer. If you have ovarian, breast, or colon cancers, you are more likely to have endometrial cancer. O for obesity, L for late menopause, D for diabetes, N for nulliparity, which is a term for woman who hasn't given birth to a child, U for unopposed estrogen, which is seen in PCOS, polycystic ovarian syndrome, and anovulation, T for tamoxifen, which is seen in chronic usage. Tamoxifen is anti-estrogenic medication in breast. That's why it's used in breast cancer. And it's estrogenic in bone and uterus. It's increasing the risk of endometrial carcinoma and uterine sarcoma. For the treatment, we are generally using surgery. And that's the end of this video. If you liked it, please push that like button, subscribe to my channel, share this video with your friends, and see you on the next videos.